Hey folks, it's Patriot Nurse, and in today's segment, I want to give you guys an update as to the flu and what's going around with the flu, and also some things that we can do to be prepared more for what you're seeing right now. So, the first duty of every intelligent man or woman in this case is to state the obvious, and the obvious at this point is that in the United States, we're seeing a pretty severe outbreak of all respiratory diseases combined right now. In many cases, these are flu variants. In many cases, they're not flu variants. They could be your rhinovirus, which is your cold, but also we are seeing outbreaks of mumps. Yes, mumps. We're also seeing outbreaks of other respiratory involved infections, right? And adenovirus is another one that's getting a decent amount of coverage right now. But there's a lot of viruses that are going around, and there's a lot of disease that's going around right now. So one of the things that people ask me is, okay, well, like when do I do something? When do I know whether or not it's a severe problem? And when you've got, for instance, respiratory involvement, the thing that you have to make sure that you pay attention to, especially in small children and in the elderly, is the airway. And the airway, breathing, and circulation, the ABCs. I know a lot of you guys are familiar with that, but with the airway specifically, when you have children, when they're dealing with upper respiratory infections, a lot of times they can get real gunky. But what I'm listening for specifically as an indicator of medical emergency is the wheezing and the like. That's a problem. That's like, we're going to the hospital right now. If not sooner, we're going to the hospital right now, and I'm calling to let them know ahead of time that we have a child with an airway compromise. When you've got children that have swelling and their airways, for instance, are about, the size of your pinky, any sort of edema or swelling in that area, that's going to put the kid at risk for asphyxiation, okay? And that is something that you have to pay attention to. So that's one of the main, hey, wake up factors there, that you have to pay attention to the airway and signs of airway compromise in these kids. When you've got kids that, for instance, with epiglottitis, and the epiglottis is the little covering that keeps stuff from going down into the trachea, the breathing tube. And when you have a child, for instance, who is dealing with an upper respiratory infection, and they start to have localized edema, localized swelling, when that epiglottis that keeps food particles normally out of the airway, when that starts to swell, it can close off their airway, and they can essentially be smothered to death, be suffocated by the swelling of the epiglottis. So that's one of the things that I would encourage you guys, just to pay attention to if you are taking care of young children in the midst of this respiratory nastiness that's going around. It's an interesting thing to watch from an objective standpoint, to look at the ways in which hospitals are taking care of the increase in patient census, which is your patient count, how many patients are coming in there. In many cases, the folks that I've talked to, and my friends all across the country, they're seeing that beds are being harvested, sacrificed from lower acuity units, for instance, labor and delivery. But beds are being taken and being reappropriated to certain areas of the hospital: med-surg overflow, ER overflow, respiratory, all of that stuff. And so right now, of course, a lot of hospitals are sacrificing beds and pulling them to different units, but they're also putting people in the hallways just because they do not have the facilities to take care of the numbers of people that they're seeing come in. And in recent days, there has been a viral video going around of a sister nurse who essentially was chastising people, and rightly so, for bringing their non-symptomatic, non-sick people into the ER, like different teams going to well wish and get well soon other people. Like, listen, if you are not sick or taking care of someone who physically cannot get themselves to the ER, you have no business being there right now. None whatsoever. Like, stay out, stay away. There's zero reason for you to go in there. And the nurse who made the video rightly noted that for each person that goes into the ER and comes out, your risk of carrying the virus and well, not just the flu, but other viruses in general, your risk of coming into contact with that and then becoming a carrier of that yourself, it's just making the situation worse. In the part of the country where I'm in, a lot of schools right now are just closing and closing and closing to try and get a hold of the disease that's going around. So definitely pay attention to your family's nutrition. Make sure that you are eating your colors, and make sure that if you have, especially children who are sick, that you're paying attention to that airway, okay? And in many cases, these things can go really, really fast. It could start out with the kid has labored breathing, and then suddenly you hear, like that's it. Like listen, 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 and pay attention to the airway. Pay attention to the airway. So that's just an update. I hope it was helpful for y'all today. If you did enjoy the video, you definitely want to subscribe. Hit that button if you haven't already. You can also like me on Facebook, and you can come out to class. I'm going to be having classes really all over the Southeast this year. I have 4-day classes that is essentially everything that I teach, and that's available in the Knoxville, Tennessee classes. So you can check that full schedule out at the website if you haven't done so already. I would love to see you in class. Hope it was helpful for y'all. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.